Today, we're taking a closer look at the humerus. That's the single long bone in your upper arm. Our mission to quickly get to the heart of what makes this bone so important for movement beyond just, well, learning names.
Right. And it's fascinating because it's basically the bridge. It connects everything. It links your shoulder blade, the scapula up top, down to your forearm bones, the radius and ulna at the elbow. It's really central to how your whole arm works.
Okay, let's start at the top then. The proximal end. You've got the head of the humerus, that smooth ball shape fitting into the glenoid cavity of the scapula. That articulation gives amazing mobility, doesn't it? But where's the catch? Where does it get risky?
Well, right there at the top, you hit a key point about injuries. There are actually two necks. There's the anatomical neck right below the head. That one rarely breaks.
Yeah.
But just a bit lower below the tubercles, those bony bumps. That's the surgical neck.
Surgical neck. Okay, why that name?
Because that's the spot. It's much more commonly fractured. It's narrower, less supported maybe, definitely more vulnerable, particularly if you fall.
Right. So that's the danger zone structurally. And near there, you mentioned the tubercles, greater and lesser.
Exactly. The greater tubercles on the outside, the lesser is more towards the front. And these aren't random lumps. Think of them as anchor points.
Yeah.
Really crucial ones for your shoulder muscles.
The rotator cuff muscles.
Precisely. They attach right there. You've got three attaching to the greater tubercle supraspinatus, infraspinatus, and teres minor. And one, the subscapularis, attaches to the lesser tubercle, and between them there's this groove, the intertubercular groove. The long head of your biceps tendon runs right through it. Plus, major muscles like pec major and lat dorsi attach to the edges of that groove. It's a busy area.
Okay, let's move down the shaft, the main body of the bone. It changes shape, doesn't it? More round up top, then kind of triangular lower down.
Yeah, it does transition. And on that shaft, about midway down the outside surface, there's a rough patch called the deltoid tuberosity.
Ah, for the deltoid muscle, the big shoulder muscle.
Exactly. That's where that powerful muscle inserts. It's what lets you lift your arm out to the side, abduction, a really key anchor point for power.
And on the back of the shaft, there's that spiral groove, the radial groove. What's significant there?
Oh, very significant. It's not just a groove, it's a pathway. The radial nerve and the deep brachial artery, the profunda brachii, run right along in that groove.
So if you fracture the midshaft?
Exactly. That nerve is really vulnerable. Damage it, and you get wrist drop. You wouldn't be able to extend your wrist or fingers. Yeah. It really highlights how anatomy dictates potential problems.
Okay, down to the bottom end then, the distal part,